We have here a 71-year-old widow who has a huge mass located at the parietal area, both sides. It is in the midline, so extends. It's more going to the left parietal area, a little bit to the right parietal area. And it started 20 years ago, and there are no other accompanying signs and symptoms, but she noted there is progressive growth for the past 8 years. So we're going to excise this tumor under nerve blocks as much as possible, no pain. So we're going to mark the axis, central axis of the tumor. This is the center, and then this is the width. We look at the border, doesn't look to be malignant, looks benign. So we're going to preserve skin, because this is big, make an elliptical excision. So we preserve as much as possible normal skin. So we want no tension during the closure. So that is approximately lines of incision. Now we're going to block the nerves. This is the midline. The main sensory nerve is the supraorbital nerve on the left side. Then you have the supratrochlear nerve. This is on the left side. Now the supraorbital nerve, there is a posterior branch. This is the temporal line. So that is the posterior branch or lateral branch. Now, since it extends beyond the midline, you have the supratrochlear nerve here. That's your guide, the fold, corrugator. That is another nerve. So you have that nerve. This is quite far. Just for landmarks, this is the supraorbital nerve on the right side, because you might extend here. So we're going to block the nerve in here, the supraorbital nerve on the left side, supratrochlear nerve on the left side, supratrochlear nerve on the right side, and the supraorbital nerve on the right side. So we start by blocking the supraorbital nerve. So the direction is here. Enter in the soft skin. Absolutely, it's a painless procedure. She still feels something here, so we need to add more. So this is just like ambushing the nerve. You see the blood vessel? So we're now using 1/4%. This is still quarter. Wants to make sure that no pain. You see the blood pressure rise if there is pain. So you have to make sure that it's painless. 1/4%. This is saline. So what you do is bloat the area around the tumor. This is for vasoconstriction around the tumor. This is using saline with 1:200,000 epinephrine solution. You want the procedure to be less bleeding. To do that, you bloat the area around the tumor. Now we will make our incision here. So our incision will be here. We inject along the line of incision. This is also some kind of hydrodissection. Takes a little bit longer, but you make the procedure easy. Hydrodissection. So you don't give so much local anesthesia because it's saline. So we start here. You make superficial incision. Don't use the tip of the blade so as not to rupture the cyst. Same, you preserve a cuff of skin. So superficial incision. You handle the blade lightly. Now you do a traction, counter traction. Now, you already have the plane. What you do is the side of the blade, which is sharp, is directed outwards so that you don't puncture the capsule. See that? It's clean. Again, your blade should be pointed outwards. This is the way to close it. You start in here, full thickness, so that you don't have bleeding. You avoid dog ear. So, nasa gitna ka na ngayon. Dito ka para hindi magdugo. Kailangan kuha mo yung gilya.